Appreciate that very much. Just one final question in regard to that topic. So the issue of the $300 million capital appropriation for Oneida County and the $700 million appropriation for Brooklyn in the current fiscal year was, as you both recall, the subject of much discussion among the legislature and the executive a number of months ago. Is there something, well, the question is, the $700 million remained, the $300 million was not reappropriated. So I guess my question is there something that Brooklyn is doing that Oneida County is not doing that would have initiated this proposed change?
Right, so I think that, and it's an excellent question. I think the situation here is in Oneida is focused primarily on a hospital.
Right.
And it's strong, as I mentioned up there. The situation in Brooklyn is more fragile in some ways. The central and part of Brooklyn healthcare system is and I think that's the active word there. The system needs to be restructured, and that's what we are tackling, as I mentioned before. And it requires more than just hospital or several hospitals. It requires how do we tackle this across the whole community-based clinics and other areas. In Oneida, the focus is primarily on a hospital, and I said I'm happy to sit down and meet with the team there and sit and speak with you further about that. So I think that's the difference. One's a system and one's a hospital. Okay.
Thank you, Commissioner. I appreciate your willingness to sit down and have further discussions. Thank you.
Thank you, Senator. We've been joined by Assemblywoman Latrice Walker, Assemblyman Ortiz for questioning.
Thank you, Mr. Chairman. Good morning, Inspector General and Commissioner. I have a few questions. The first one has to do, Commissioner, can you comment on the status of the organ donor registry implementation, please?
Sure. So this is something which we have been moving forward with for a period of time. There is a New York State donor life registry, and we've been working on a public-private partnership on this. And we have identified New York Alliance for Donation, NYAD, or NIAD, who will lead us forward on having more of an effort to get individuals to donate organs, obviously, to help many other lives. This is now with the comptroller, the budget proposal, or the, I should say, the documents have already moved forward to OSC on that. I know it took a little bit more time than one had originally wanted, but there are many issues involved in this. There's issues also of privacy and to make sure that we do this right. And so I hope this will help as we move forward with increased organ donation in the state of New York.
And I hope that we can continue to work together on that. My next question is regarding many years ago, we opened like 3 centers, Eating Disorder Center. The Eating Disorder Center was located in Rochester, Albany, and New York City. Throughout the years, it sounds to me that the money has completely disappeared to trying to maintain and continue the services of eating disorder in New York State. The Department of Health, your agency, do they have any alternative initiative, alternative plan in order to address eating disorder in New York State?
I know that this is something which we are interested in. The details of exactly how much and where we have that, I can get back to you on that. But I do know that this is something which we need to tackle. It's also, and it's an important issue. It ties back to issues of primary care. It ties back to the fact that somebody with an eating disorder should be picked up relatively early, and also works towards the issue of prevention so that the complications that would occur as a result of that condition are avoided.
Well, I hope that you can look into that, because I was the legislator who passed the bill about opening the 3 centers throughout the state of New York, and we allocated about $1.5 million. And it sounds to me that today the center in Rochester has been closed down. The center here in Albany is just trying to maneuver whether or not they can continue to be alive and the center in New York City, Columbia Presbyterian Hospital, also is having difficulty. So I hope that you can reevaluate, go back, and please look into this very, very, very seriously, because that brings me to my next issue, which we cannot talk about eating disorder without talking about obesity, the obesity epidemic that we have in the state of New York and in this country. As you probably know, and maybe you don't know, but being the legislator who has been fighting to address the obesity epidemic in New York State for many, many years since I've been in office. As a result, that obesity, obesity brings so many different chronic diseases. From obesity, you have diabetes. From diabetes, you have cardiovascular. From cardiovascular, we have kidney issues, and so on, so on, so far. Neuropathy as a result of diabetes. And this is an issue that also impacting very highly onto our children. As a result of that, the EU agency and the reporter and the report from the Comptroller's office apparently have an agreement that one in of every 4 child will suffer from pre-diabetes. A couple of things on here. Number one, I have introduced legislation where I do believe that the same way we need to take care of the physical of our children, we need to take the mental health issue and do better assessment within the school system at the early stage of the children's life. So therefore, the first bill was to address that we should do a screening of blood screening from pre-K all the way through high school, even in intervals of grade, where we will be able to identify whether or not what is the potential based on the history, the family history of the child, that this child might develop or might have diabetes, and how can we go and implement a plan of action to treat this child. That's one of the legislation that I have in place. Second thing I would like to say that as a result of diabetes, most of the time diabetes impact more minority community. As a result that we have so many junk food in our community, and really is a catastrophe. So as a result of that, I also have a question for you regarding the topical oxygen wound therapy that has been used in the Department of Defense, has been already implemented in 19 states. And this is a therapy that really go to the wound of the individual to cure diabetes, and it's very inexpensive. Can you tell me what has been the plan of action that the agency has taken in reversing this to be out of the budget and also removed from Medicaid reimbursement?
So we have a panel that is actually governed by state statute now, that in terms of a panel of outside healthcare experts that we convene to advise the department on changes to the Medicaid benefit package in terms of what are covered services and such. That panel recommended to not cover the wound therapy that you're describing. And then as a result of that, litigation was instigated by the manufacturer of the mechanism of treatment. And so right now, we're in the midst of litigation on that issue.
Well, let me just put this on the table that and on the record that most of the folks who are using this, including right now, they're using it at the Department of Defense for our own veterans, and 19 states have already moved forward to implement this kind of therapy. I hope that those advisors will revise that and go back, because this is impacting very, very heavily minority community, and that this is very cost effective. As we're talking about the escalating healthcare costs in our country and in our state, and as CART has been trying to implement in order to save money, this is another alternative that can be able to save money at the end of the day. So, Inspector General, I hope that you can go back and have a great conversation with your advisor, and I hope that we can come out with a positive resolution where our people, my community, who's suffering a lot from diabetes, and I have an uncle who was taking this therapy. Over the son, we had to pay for it, and it's become to be a little expensive. So I hope that you can put in the word for those who cannot afford, as a result that they don't have the means and the financial means to get this treatment, that you will be able to convince them that this is the right thing to do. And we're getting a lot of letters, a lot of people visiting my office as a result of the impact that this will have in the underserved community. Thank you, Mr. Chairman.
Assemblyman, just one thing I want to clarify. You had mentioned about the eating disorders, and you brought up the obesity issue, and just from the medical world, usually I was thinking about eating disorders. Usually anorexia is what we sort of look at as eating disorders, and so I was not thinking from the standpoint of obesity, but I agree with you 100%. We are working very hard on this issue, and we are working on this from our prevention agenda and across all different areas, and I agree it needs to be tackled both in the school system, it needs to be tackled even before elementary school, and particularly throughout high school as well.
And I will, Commissioner, thank you for your comments, and I would like to say, last but not least, that I have worked on this issue for my last 25 years, 20 which is part of the Assembly, 5 before this as epidemiology. So I hope that you and I can work together to make sure that we can address good public policy that can, that we can probably 10 years from now can talk about how effective this public policy, health public policy have become as to help our children to be on the workforce. They don't have to be depending on dialysis rooms, and this kid doesn't have to be depending on pacemaker or cardiovascular problem and neuropathy. And I hope that that this conversation will open a relationship between you and I to endure and to do the best we can for the people of the state of New York. Thank you very much.
I agree. Thank you.
Thank you, Assemblyman. We've been joined by Assemblyman Whitburn. Senator.
Thank you, Assemblyman. Our next speaker is Senator Jim Seward.
Thank you, Madam Chair, and I want to say good morning. I think it's still morning. About 3 minutes. Commissioner.
2 minutes over.
Great. Good morning, Commissioner and Mr. Helgerson. Thank you for being here. I wanted to zero in on the demise of the Health Republic, the co-op that went belly up last fall. And I regret very much that the Department of Financial Services is not going to be with us here this morning, because it's pretty obvious that many of the decisions made at that department have a direct impact on the delivery of health care here in New York State. But you are here, and I'd like to discuss this issue with you. As Senator Hannan mentioned, we had a roundtable the first day of session on this very topic. As chair of the Insurance Committee in the Senate, I was pleased to co-host that with Senator Hannan. And we're really talking about a health plan, a co-op with over 200,000 New Yorkers who suddenly lost their health insurance coverage. And in September of last year, of course, the Department of Financial Services directed Health Republic not to continue to write new coverage, and then, of course, November 30th to actually cease operation. But in the meantime, healthcare providers continue to render service to those subscribers, and running up a total of, it's estimated, over $200 million in unpaid claims. I've heard estimates of hospitals alone of about 160 million, perhaps higher, and of course physicians and other medical providers making up the balance. So we have a serious problem here as it relates to our hospitals. Many of these hospitals already in financial distress and stress, and of course with claims going unpaid to physicians and others, I think it makes it very difficult for us going forward to recruit new physicians here to New York State when we have this type of situation lingering here in the state. There are many reasons for the demise of Health Republic, but clearly something went terribly wrong in terms of the regulatory oversight, in terms of the state regulatory function of ensuring the solvency of a health plan here in New York State. So my question to you this morning is, my reading of the executive budget does not show any funds to reimburse these providers for the services that were rendered by to the subscribers of Health Republic. And if that is the case, two questions. Do you agree that this is a very negative and disastrous impact on healthcare providers, hospitals, and others here in our state to have unpaid claims of this magnitude? And do you believe that funds should be identified in a final budget to cover these unpaid claims?
So the department's focus on this has been very patient-centric. We have had an opportunity to have about 64,000 calls from those who were members of Health Republic or covered by Health Republic. We've had about 350,000 contacts with them, whether through email and other letters and other ways. We've worked very hard to make sure that those who were enrolled in Health Republic have been covered. We have 85% of all those who are enrolled in Health Republic now enrolled in another plan. That is close to our 90% that we have. Sometimes people go to a different path, and we offer them 3 plans and opportunities to get enrolled, and we've done everything to get them into a plan that will help meet their needs. And any small glitches in that we've also worked through as part of our team. The issues regarding the finances here, I really do direct back to DFS because that's where this falls, and I would ask you to direct it to them rather than specifically to the health team. But from the standpoint of what we're doing for the individuals who are covered, we have really moved forward diligently on that.
Well, I would agree that there in terms of getting the previous subscribers of Health Republic re-enrolled, that there was aggressive action taken there, and certainly as I said earlier, I regret that the DFS is not here to ask the questions regarding this issue. However, my question to you is your testimony related to funding for distressed hospitals and other ways of funding our hospitals. Wouldn't you agree that a $200+ million of unpaid claims is a serious financial problem for these hospitals and other providers that will have a very negative impact on the delivery of health care in New York State? If this issue is not dealt with?
I think we should wait to see what the final outcome with those resources are. But again, that would be back to DFS. There's a lot of challenges on hospitals, and we're trying to tackle the ones that fall within the Department of Health, and I'm happy to push forward on those that particularly if we've heard already some of the issues for the distressed hospitals and what falls within the department's realm. I'm glad to move forward, but I think this sort of falls within DFS.
Well, no further questions.
Thank you. Assemblyman Oaks.
Thank you, Commissioner. Wanted to touch on the exchange and the costs. I know originally the intention was to have it self-sustaining. We've had costs in the current fiscal year, and then we have proposed ones in the upcoming one. Are we increasing, decreasing in that, or staying about the same?
We've had, from the exchange, we have 2.7, from the standpoint of people, we have 2.7 million people now enrolled in the exchange. We have a state with only 6% uninsured, which is down basically in half or close to in half from where it was before. We have more enrolled, obviously, as Jason has mentioned, about Medicaid. We have a budget that's $575 million that is coming from the federal government, I believe, and $484 million that's cost for it to run the exchange or for the exchange. We are making progress on that. There is also funds from the federal government, and as we are moving towards more of an essential health plan, which is sort of the basic health plan, we will have additional savings of probably about $500,000 on that.
So do you think going forward then we'll see increasing costs net to the state, or
Sure.
Yeah, so I probably answer that because in addition to the launching of the health insurance exchange and the qualified health benefits, the tax subsidies that are provided to help individuals buy commercial insurance, we implemented in New York that initiative. At the same time, we also implemented, basically created a one-stop shop for people to access health insurance, and that includes the Medicaid program. And if you look at the 2.7 million people who have used the exchange to date, the vast majority of those people are actually accessing using that service to access the Medicaid program. And what we're in the midst of doing is a multi-year takeover of the responsibility for Medicaid administration from the counties. And so, your question is, will the budget for that centralized function grow? And the answer is yes, it will grow. But at the same time, the amount of money we spend at the county level for the administration of the Medicaid program will decline. And we think at the end of the day, the net cost of administering that system, that single unified system, that single one-stop shop for healthcare, will actually be less than what it cost us to administer just the Medicaid program on a county basis.
Jumping to a topic that I brought up before on the executive order on immigration, I know it's been discussed some today. Do we know the numbers that are going to be impacted by that in this fiscal year? And again, do we see that as a increasing item in the future?
I have to go back and look at the fiscal for the executive order. I mean, actually, I think as was the Commissioner mentioned, the creation of the Essential Plan, which was an initiative in last year's budget, generated substantial savings to the taxpayers of New York. And the reason was that we had this population of legally resident individuals who are not here illegally, but are not eligible under federal law for Medicaid, but are based on our Constitution on the program. And so we were funding those expenses to the tune of almost $1 billion a year, and that was entirely state-only funds. And what the Essential Plan allowed us to do was, we know in the individuals who made the transition from Medicaid to the Essential Plan are different. They got the same benefit package, same cost sharing and everything, but we were able to avail ourselves of federal funding through that program to cover the vast majority of those expenses. So as a result, the cost of legally resident but non-qualifying, as it's referred to, immigrants to the state of New York has been substantially reduced because of that initiative. That said, we'll get you more information about the fiscal that went into the President's executive order, which is obviously still remains stayed.
Thank you. Also, there have been comment or questions related to the Donate Life Registry. I guess I would just ask the question, and I know you made some reference, Commissioner, to saying, that we're going to be making progress on that. I know we've had, among the lowest donor levels, I guess registry levels, and donor. Have we made any progress on those items specifically yet, or hope that we will in the state?
So we have about 4 million people registered as organ donors in the state as of the first of this year. And as I mentioned, the award has been finalized and it's now with the controller, so hopefully that will help move forward. I think and once that is awarded, then all the efforts to further outreach to get more people registered will happen. I know there's been a lot of discussion about other ways to do this and partnering with other agencies as well, and we'll see what else we can tackle.
We'll look forward to that happening. One final question, I know that in last year's or the current year's fiscal budget, we had enacted some provisions to help with exorbitant out-of-network costs as it related to some of those expenses with the Affordable Care Act and out-of-network. Have we made some progress during this past year on that issue.
Are you referring to our plans, the marketplace, or are you referring to in general?